Hello and welcome. So today we are at the Detroit Zoo for the Epilepsy Foundation walk. So we're going today with this live stream to answer all the questions about epilepsy and seizures and to support our Epilepsy Foundation in this fundraising broadcast and live stream. So please make some donations to the Epilepsy Foundation. All of the donation will go to the Epilepsy Foundation for the cause of epilepsy. And let's kick it in. So we'll take all the questions today about epilepsy. Hello, Mr. Ramsey, and we will talk to people and ask them about epilepsy. So we have hey guys. So I'm Dr. Danu, and I'm one of the epilepsy neurologists. And today I'm doing this fundraising live stream for Epilepsy Foundation. So I will be asking. So first, like, say hello, everyone. Hello. So So I will be answering questions. So what are you doing today at the walk?
Strolling for epilepsy.
So we're strolling for epilepsy. Excellent. What are you doing?
Yeah, we're walking for the epilepsy.
For our friend.
Yeah.
Strolling for epilepsy.
Excellent. We're all strolling for epilepsy today, and I'm answering questions. So what questions do you have for the neurologist who treats epilepsy? So if you have any questions about you, your son, your family.
Well, so how does one get epilepsy? How does that come about?
Excellent question. So the question is about how somebody will get epilepsy and what are the causes of epilepsy. So epilepsy is a condition that is mostly can be acquired and can be genetic. So there are so many causes of epilepsy depending so much on the age. So epilepsy can happen in people who are young, and the first 6 years of life are actually having the most amount of epilepsy happening. And the causes of that is mostly from birth trauma and asphyxia, lack of oxygen can be due to genetics. So when there is an abnormal gene that will manifest early in life, metabolism, and lots of kids will have infections early in life, and those infections can cause epilepsy due to scarring of the brain. After age 60, there'll be some plateau in the epilepsy causes, but it still can happen in 1% of the population. And then after age 65, there is a huge peak of epilepsy coming up, and those are caused by scars in the brain. Will be stroke, the most common, traumatic brain injury, head trauma, and brain tumor. So those are the causes of epilepsy. The way we pick up those causes is doing testing. So we do testing by doing brain imaging scans. We do a physical exam to pick up if there is any scar, any abnormal cells forming in the brain, and we do EEG to see what the brain activity is. And we can do also some testing for the electricity in the brain and know which type of epilepsy we're dealing with. Excellent. Any other questions?
Is that when it's a trauma like that to the brain, then is that always? Are you going to see more of the scarring after the age of 65, or could that even be an athlete who went hard playing football for however long or hockey and they've had multiple concussions?
Yeah, so the trauma can be at any age, and any person can have trauma and epilepsy because of that. So depending on how strong the trauma was. So if the trauma was small, there's no just minor concussion, it might increase the risk of epilepsy a little. But if it was bleeding in the brain, we call penetrating trauma. There is blood in the brain. Those can increase. The blood is returned to the brain, and that can cause epilepsy to happen a little more than just
sooner than the age.
Sooner than the age, definitely, yeah. So at any age, anyone has trauma, they can have epilepsy. Any other questions? Well, thank you so much for walking for epilepsy and for participation. Thank you. Yeah. You're welcome. Thank you. Yeah.
All right, let's keep strolling.
All right, so we'll take some more questions, and feel free to donate for our Epilepsy Foundation on this YouTube live stream, and we'll take some more questions. Hello, hi, engineering. Hello, doctor. So talking about clonazepam tablet, can you describe it? So clonazepam is one of the medications that we give for epilepsy. It's one of the benzodiazepines, so they are not our favorite medication. Some doctors give it to pediatric children with epilepsy. It can cause dependence, which means that kids will have some tolerance and dependence, and we might need to increase the dose with time. But overall, we don't prefer that too much, but some kids do have it. Hello. Thank you so much for doing. We get more advocates. Thank you so much. And that's what we have. Can you advise me about Kebra, which started since 1 month? Excellent. So Kebra is a medicine that is given for seizures and epilepsy. It is considered one of the safe medications, and it is given a lot for people with epilepsy. And this medicine is good, but there is a problem with that medicine, which is psychiatric side effects. So people with Keppra can get angry. They have some depression, anxiety, PTSD symptoms, all of that. So we have lots of side effects from Keppra from that psychiatric. But if you don't have those side effects, it's a pretty good medication for seizures and epilepsy. There is a way to improve post-ictal state faster. So yes, so the way to improve post-ictal state is which is the state that happens after the seizure. The patients will be confused, will not be walking well or talking well, and all of that. So the way to improve it is to treat the epilepsy, and some devices that can also improve this. Is there any device that is approved for the watches? So the watches are designed to detect seizures and epilepsy. They do not treat seizures and epilepsy. So yes, there are multiple devices on watches that are approved. The Embadica watch is one of the best ones, and we have other devices. But these are just watches for detection. What about Onfi medicine? Onfi is also, it's called clobazam. It's one of the anti-seizure medication that we can give. The Frisium is the other name. So those medications can be given to treat epilepsy, and they are considered safe and good. Why we can't grow epilepsy trauma? Because there is a scar in the brain, and those scars are staying there for all the time. So that is the reason why it does not get cured or improved with time. But so you can be treated but not cured. Can you come to the walk loop in North Carolina? Maybe, hopefully we can. Hello everyone. So we have lots of people joining us in this nice walk. So we'll keep talking to people and try to get more people to participate. But yes, excellent. What about carbamazepine and phenytoin? So carbamazepine and phenytoin are medications that can be given for epilepsy. And those medications are, they have side effects. They are sodium channel blockers, so they work on the sodium channels, and they are focal epilepsy only. They don't treat generalized epilepsy. Actually, they can worsen generalized epilepsy. So we have to know what the epilepsy type we are doing and treating. And then the second thing is that this medicine have some long-term side effects on the bones. So I made a whole video about carbamazepine, Tegretol, so you can check it out for full information. Sorry, Patrice. I am taking lamotrigine 100 milligrams, several headaches by taking such medicine. How I improve it? So those are specific questions for like your case. I'm not sure like what is the cause of the headache. Do you have migraine headache or not? So I would suggest you talk to your neurologist to evaluate the headache itself, because epilepsy and migraine headache can happen together, and they need both to be treated and be helped as well. I would love to meet more people like you. How about Onfi side effects? So Onfi can have some sedation, stomach upset for children, drooling. It depends on the dose and the duration of treatment, so it can be different from every patient and another. Long-term side effects of Keppra. So Keppra is usually considered a safe medicine on the long term. Some of the side effects that we have is as I said, the psychiatric side effects. If it does not happen, usually it is a very safe medication. There are very, very rare cases of causing some platelets of blood issues, but overall it's a very, very safe medication, apart from those psychiatric side effects that keeps happening. Is it normal to take 3 different medications, complex partial seizures? What can be the side effects? Yes, we have patients who are resistant to treatment, and we need to give them multiple medications for us to control the seizures better. So those medications can be given in multiple patients, and the reason why we give multiple medications, because some epilepsies are very resistant and difficult to treat. So that's why we need to take some more medications to help them. Side effects, whenever we have multiple medications, the combination of them are usually more. So the more medications we have, the more interactions they have, the more side effect potential that there is. But you know, we have to always balance between side effects and effects of treatment, because if we leave epilepsy untreated, that can cause them to get worse over time. And if somebody has 3 medications and they're still having seizures. At that time, we call it drug-resistant epilepsy, and those need to be treated better by doing surgical treatment and help them better control the seizures. We have multiple people helping us today for, and everyone is happy with this epilepsy walk, and hopefully we have more people like you joining us in the future for future walks. And we are in Detroit, Michigan, so we're in the Detroit Zoo and trying to help the people and answer their questions about epilepsy and get this fundraising. So please make some donations for our Epilepsy Foundation, which is the sponsor of this walk. So it'll be great for us to receive some help, and I will definitely match that donation. So everything you do, I will match it here on this live stream, so that we can support our people with epilepsy. And one of the important things when we choose the treatment for epilepsy is knowing the diagnosis and the right epilepsy syndrome. So not every medicine for epilepsy works for every type of seizures and epilepsy. So we have 2 types of epilepsy. One of them is called focal epilepsy, which is seizures are coming from one spot in the brain. And the other one is called generalized epilepsy, when seizures are happening throughout the brain. And those are completely different types, completely different diagnoses and different treatments. Focal epilepsy, all the medications work for focal epilepsy. However, in generalized epilepsy, it is not true. Some medications that are given for focal epilepsy, like the family of sodium channel blockers, they can worsen generalized epilepsy and make the seizures even happen more and get worse. So it is important to know that not every medicine for epilepsy works, and not every medication that is for epilepsy works for all different types. That's why it is essential to know the type of epilepsy, which are the treatment that is correct for the syndrome. And the way we do that is to get a good EEG, brain MRI testing to know what type of epilepsy we are treating, so that we know what type of epilepsy we are getting to have. And we're almost at the end of the walk and reaching the end line. And I'm excited to help more people with epilepsy and answer all the questions that you may have. And going back to our our tent that is for the Henry Ford Hospital, which is my hospital, and that's where I work and help patients with epilepsy. And if you need help with your own case, I can always review your case and provide medical advice and kind of second opinion by the remote second opinion one, which is specific for consultations for the international patients. And so we have picture taking for me. Here's the finish line. So I reached the finish line on this live stream. So thank you all for joining us. And hello, guys. Yeah. And it's reaching the end. Thank you so much for joining us, and we'll see you in the next video.